Phil, tell me all about Patient Line. What's new about Patient Line at the moment?
So what's new this year is really that we've brought on some other European languages, and in particular Portuguese, Polish, and Greek.
Okay.
And
How many languages do you cover at the moment?
11.
Oh, really?
Yeah.
That's a lot.
And another 3 next year. So
Wow.
that'll take us to 14.
Okay.
And with the diversity of the planet, you know, we reach out to more patients and more people by having the diversity.
What's the goal of Patient Line?
It's pretty straightforward, really. It's around reassuring patients, giving them what I hope is a really balanced opinion about, actually, you know, in your discussion with your clinician, be it surgeon or non-surgeon, there should be some shared decision making. And for shared decision, you both need information. And this gives some patients information that they can absorb in a really acceptable way, clarifying what their concerns are so that they can then maybe have a more productive discussion with their clinician. So I think it's really valuable. As doctors, we try and help people, and we do that by reassuring them. But our being a nice doctor and reassuring somebody has a treatment effect of about 6 weeks. Whereas if you read something and you think, oh, so that's what happens, sciatic does get better usually, and it doesn't usually recur, that has a cognitive reassurance that scientifically we know lasts about 12 months to 18 months. So it not only is information, it is actually engaging them in self-management, trying to improve outcomes by giving them control within them, rather than going to the doctor and thinking, oh, the doctor's going to fix me, here's some stuff I can do. Here's some stuff that will improve my outcomes.
So you see it really part of the treatment.
Yeah, I think so.
The way people avoid and use internet to get their information is changing, seems.
It is, yeah. I mean, I think 10 years ago, people thought the internet was, oh, look, I can research this myself, I can diagnose myself. People are getting wise that there's a lot of stuff out there that's not reliable, and we now know that if seeking healthcare advice on the internet, unless it's a reliable source, tends to result in you going to see your doctor to get reassured that you haven't got something serious. So hopefully, in terms of the greater health of the population, we'll reduce some of that need for healthcare advice and put it in patients' hands so they're in control. Something that would be really fascinating would be if you could then feed, say, spine Tango information into some of the operations that we're describing, so that patients can then see how often it's done, what sort of results they might get, so they can realistically manage expectations, so they can say, oh, actually, I'm going to get an improvement. I'm not going to be absolutely pain-free, but I'm going to get a really useful improvement with this.
Yeah, but by the way, what about Spine Tango, or shouldn't we call that EUROSPINE registry now?
It is the EUROSPINE registry. The Tango data feeds the Patient Line, but also the education program.
I see. Got it.
That we really, get real life information to the persons, to the patients, and to the care providers. And there was that very interesting paper that was awarded, demonstrating really that the value of that good registry data is as good as RCTs.
Oh, that's perfect.
And reflecting really real life over a very large population rather than a highly selected, and because of that probably partially biased population that has already only the benefit from knowing that they are in the study. We just changed our service provider with several ideas in mind. First, to have excellent service and to improve the website where you introduce your data and where you get back, because there is something for the database, but there is also something for the provider, for the contributor of the data, that he can look to his activity and have a benchmark as compared to the whole pool, see where he is good, see where he should improve. We know that the industry that is surrounding us here, they really badly need precise data about outcome, about their implants. And of course, we can provide that data absolutely anonymously, and it's a project that was fantastically supported by EUROSPINE over the years, with questioning, which is fair and fine. And I really have now the feeling that we are taking that steep improvement in numbers of cases and contributors, in quality of data, and maybe self-sufficiency, financially speaking, with complete independence.
Frank, that fits really well with some of the stuff that you're doing on these centres of excellence. What criteria do you judge by, or is there a ranking system, or how does it work?
In fact, all of these. So in fact, the idea behind that was very simple. We want to improve, let me say, surgery throughout Europe. And we have a lot of programs for the individual surgeon, the training programs, the educational programs, the surgical, the non-surgical, and so on, and all the diplomas. But you know, the surgeon is as good as his institution is, you know, because if you're a brilliant surgeon, yes, and if you're a brilliant surgeon in an awful institution, you will not deliver good quality. And so the idea comes up to certify the centers as well. We have worked together in a working group, 14 different people, 10 different nations for more than 2 years to create guidelines how to test and certify such a center. And we came out with a whole list of guidelines. It's like a TÜV for your car, you know. So you had 200 criteria which you have to fulfill with regards to equipment, education of your staff, quality of your things, SOP, quality assurance programs, and so on. It's a lot of longer list. But if you want to learn more about that, it's on the EUROSPINE website already. And so what we have done, in fact, is we hired an independent audit company which does the audits.
Okay.
So that means if you want to apply for that, somebody from the independent audit company is visiting you and going through these criteria together with you. And finally, if you succeed, you get the stamp of being a center of excellence.
There are two important things. That is, I think that first, to obtain it, you have to adhere to all the criteria, so you go over all the questions. So only that step is already leading to improvement.
Yes.
And of course, then with the remarks, you may even improve later. But the other thing which I would emphasize is, Frank, you were among the first to be certified.
That's
you
correct.
are a big hospital,
Yeah.
enormous service, and obviously fantastically organized. But my small department could also reach that.
It is, in fact, not only the big units. Of course, there is a minimum number and requirements which you have to fulfill, but you can be certified for one specific pathology, for example. You can be certified for trauma or degen. So you do not have to cover it all. You can be very, very specialized, and you also can become a center of excellence. So you have to have the whole service, you know, you have to have an ICU, you have to have a 24/7 call, rehab, of course, physio, nursing, radiology, anesthesia, and all. You have to have the complete package.
Teaching center.
Teaching as well, yeah, that's also very important. Yeah. And we already have 13 hospitals certified so far in 11 countries in Europe. Can you imagine?
That's totally different healthcare systems.
Correct.
Often totally different resource. And so the quality standards, has that resulted in anyone having to put a resource in to bring up the standard, if that's what they want to do? There's a lever for the manager to give you what you need.
Of course, you know, the major idea behind that is to get better. So you get these independent external control predominantly to improve your internal services. That's the idea behind it, you know. And what was very interesting, I tell you, is that we only give one certificate for one hospital. That means if you have, for example, neurosurgeons, orthos, traumas, all doing spines, we have to work together. We more or less, we force them to work together. And this multidisciplinary work really has changed some hospitals which we were certifying, because now we really work together. You know?
And in some countries with far less financial resources, and we have a possibility for these hospitals to apply and receive a grant.
Yes, that's correct.
Michael Ogun grant.
We have established the Michael Ogun grant.
Oh, look,
You heard
that's
about
really
that?
nice. No,
Yeah,
tell
the
me about
Michael Ogun grant, you know, our former president.
Yeah.
Yeah, and so in fact we have established a grant for less affluent countries. They can apply for this grant via the EUROSPINE Foundation, And if we can make clear why they should get a grant, they don't have to pay for that certification project.